moving your feet to get the blood flowing, because we're going to have our second group of speakers come up here. Move your feet. Raise your right hand if you drove through the rain this morning. Raise your left hand if you got wet in the rain this morning. Keep your feet moving. Keep your feet moving. Raise your right hand if you're from Ohio. Raise your left hand if you're from Kentucky. Keep your feet moving. Raise your right hand if you're from somewhere else. All right, nice to have you foreigners here today. All right, get your keyboard fingers moving. Move those thumbs so you can tweet. Remember, Data Forum 17. Here we go. Turn to somebody next to you. Turn to face somebody. Put your hands up like this. Double high five while you say, I love data. Thank you. Thank you all for coming today.
All right. I'm going to bring us all back together. All right, so many thanks to Jennifer for helping us all to get moving a little bit today. We're going to move right into our first session panel today. We have some great speakers, some really fabulous conversations that we can have. I want to again thank Aaron for his session this morning, and I'm looking forward to some conversations with him later on today. And I'll try not to talk too loud. All right, so I'm going to start by introducing up Molly Crain, who is going to moderate this session. Molly is the Communications and Volunteer Coordinator for Kentucky Voices for Health, a coalition of individuals and organizations working together to improve the health of all Kentuckians. She will introduce our panel and get us started.
Hello, everybody. My name is Molly Crain, and Rochelle expressed to me interest in being a moderator for this event, and I'm interested in how technology affects society because I have an MA in communication, culture, and technology, and so I'm really excited to be here, and I just wanted to say hello. So the first person up will be Joshua Poe, who is the project manager for Youth Build Louisville. And his project is called Redlining Louisville, the Racist Origins of City Planning, Banking, and Real Estate. And then there will be, Vashti Rutledge, the Cincinnati Director, Family Independence Initiative. And then, is there supposed to be a third edition? Oh, sorry. And then Michael Topmiller, the Health GIS Research Specialist at Health Landscape. Are you Joshua? Hi, welcome. Welcome.
Thank you.
Yeah, no problem.
This
Yeah, whichever one.
Good morning. My name is Josh Poe. I'm a activist, city planner, and researcher. I've developed the Redlining Louisville story map. And a lot of people ask me, why did you partake of this project? Why did you do the project? As if there's one reason for doing it or there was one outcome that I hope to achieve. But the project was an independent research project. I began in 2011, 2012, working on a book about the history of city planning in Louisville. I was a graduate student at U of L. And my background is activism, and I became a city planner. I'm 40 years old. And I'm not one of these people who was an activist in their early 20s and then sort of apologizes for it now, as if, some people are activists and they say, well, when I grew up and became a professional, I'm still an activist, and activism really informs my work and everything I do. So when I was a graduate student at the University of Louisville, I was working on social justice issues and using research to inform social justice issues, and that's not always welcome in an academic setting. So I wasn't getting a lot of encouragement for my work. And at that time, I met the Dean of Arts and Sciences at U of L, who was the late Blaine Hudson, who was a former activist. And Dr. Hudson really encouraged me to pursue my work and really sort of lit a fire under me to continue doing what I was doing and encouraged me. At that time, I was working on land use, zoning, segregation, and the history of city planning. Really encouraged me to find the redlining maps in Louisville. Little did I know that they weren't in Louisville. They were buried in the National Archives in Washington, D.C. It took me about 3 years to locate them. Unfortunately, Dr. Hudson passed away before he got a chance to see them. So once I obtained the maps, I started thinking about how to display them, how to visualize them, and I was looking at writing a lot of code to create a website. And around that time, Esri came out with the story map format, which was really a perfect fit because I didn't just want to display the data as sort of as historical artifact. I wanted to compare the data to some metrics from today to really show the correlation between historic practices and problems we see in West Louisville today. So, is it this one? So, this slide was just the 1938 map and the legend for the map. So when these maps were made in cities, so 122 cities around the country in the late 30s, the federal government came into cities and worked with local real estate agents to evaluate neighborhoods in cities to decide where money would be invested in those cities and where money would not be invested. So local realtors met with the federal government and came up with the redlining maps for Louisville in 1938. I developed a series of tabs on the story map, and the first tab you come to is the home page where you can actually click on the various areas and read the 1938 descriptions of those areas. So there was an explanation. There was in the About tab you see the legend, you see the map itself. I also included a series of graphics. And what the redlining maps did was they really created a two-tiered economic system. So the redlining maps consisted of 4 areas, or 4 grades. Of course, green areas were the highest graded areas, and red areas were the lowest graded areas. And basically, the federal government said, don't lend money in the red areas. You're taking a huge risk if you lend there. And they used various metrics to grade those areas. The highest ranked area in Louisville was the area that we know. I don't know how many people are familiar with Louisville, the area around the Indian Hill subdivision, Mockingbird Valley. This is the place where people like Rick Pitino live, and that was the highest ranked area. They used different categories to measure that. So favorable influences was a category, and the reason that area was ranked the highest was because it contained the highest restrictions of any area in Louisville. These weren't necessarily where the nicest homes were in Louisville, or where the wealthiest people lived at the time. That area was ranked the highest because it had the highest deed restrictions of anywhere in the city, and what that meant was these deed restrictions said that you cannot sell the property to anyone unless they're of Caucasian descent. So no one from African descent can buy the property. That's what it said in the restrictions. And as you can see, one of the highest restricted areas in or around the city. Detrimental influences with lack of adequate transportation, but the type of population makes it not necessary. What's interesting is that a transportation plan was done a few years ago, and they largely reached the same conclusion. There was the inhabitants were taken into account. So as you can see in this area, the inhabitants, their occupation, it said businessmen and capitalists. Annual income was $400,000. No foreign-born families, no Negro families. They also had an area of called Families on Relief, which would have been families receiving public assistance at that time. So basically this area contained no poor people, no black people, and there was no, at that point they had a category called threat of infiltration. There was no chance that that any black person or poor person was going to move into this area. So someone could buy a home here and be very assured that their neighborhood was going to remain homogeneous. Now what's important about that today is that their wealth was created based on that fact. So a family bought a home for $4,000, and in 2 generations, that home value soared. So they were able to pass on that wealth to their family, and other sections of the city did not experience the same access to wealth. Availability of mortgage funds, ample. And in clarifying remarks, it talks about Lightfoot subdivision is well restricted, but not so high as in other properties. So restrictions ranked really high in how a neighborhood was graded. What was interesting about the redlining maps from Louisville is that we hear a lot in Louisville about the 1937 flood. These maps were made in 1938, but by that time the flood didn't play as large a role in grading these areas as the type of population that lived in the area. Louisville had largely recovered from the flood by 1938 thanks to the large federal relief efforts. So that area was graded A1. So basically they said this is the best place to buy property in Louisville. This is the highest ranked area. The lowest ranked area, second to lowest, was the area of the Russell neighborhood, which is now undergoing a Hope 6 project. Favorable influences in the Russell neighborhood. This is the area just west of downtown. City convenience, closest to the principal business district. Detrimental influence is the red light district on the eastern side of the area, an old type of obsolete house. So when they say old type of obsolete house, you got to remember this is the dawn of suburbanization. This is when city planners around that time thought that everyone's going to leave the city and we're all going to live in the suburbs, and the suburbs it's based on exponential growth, and the suburbs are going to keep expanding. And cities would largely be abandoned, and only poor people would live there. That was the idea at that time. And then mixture of inhabitants. Now, what that means is that this was a mixed income, what we call today a mixed income community, and that's what city planners are trying to create today. At that point, that was seen as a real threat to property values. So the idea that black people would live in the same neighborhood as white people was seen as a threat to economic stability, or that poor people would live in the same neighborhood as a middle-class person was seen as a threat to economic stability. It was really frowned upon in these documents. Estimated income was $300 to $1,000. Most of the inhabitants were mostly cheap laborers, mechanics. The clarifying remarks, they said that this is about the worst area of the city. Low-type property and inhabitants, and some Negro businesses extending out Walnut and Chestnut Streets. Now, what's interesting about this is what you had at this time was the beginning of a black middle class in Louisville. You had the beginnings of black, if you think about this in historical context, this is 1938. In 1860, black people were living in captivity on the waterfront. So within one generation, black people had started buying businesses, started opening businesses, so you had an emerging cultural capital. This is where Duke Ellington would play music. This is where the great jazz musicians would come to Louisville and play. You had the emergence of a real economic center. And not only the redlining practices, but the city plans that happened around the same time destroyed this section of the city. It was later bulldozed under urban renewal and replaced with surface parking lots and public housing. And this received the grade of D11. Race played the largest role in determining property values that I found in this study. From the About tab and from pulling up the documents, I included a timeline to really pull this into historical context so that you can see from 1860 on through the comprehensive plans and planning documents, Buchanan versus Warley, restrictive covenants, major focal points in Louisville's history. So you can redlining did not happen in a vacuum. So when you view the story map, you're not looking at it as just a story map, but you're seeing some other things that were taking place around that time. And also included the neighborhoods. People in Louisville really wanted to see the neighborhood boundaries because the redlining, the redlined areas didn't fit neighborhood boundaries. So I included what's called a spyglass feature where you can actually zoom over the areas and pull up which neighborhood you're looking at. So, like I said, I didn't want to take the data and just present the maps as an archive. I wanted to compare them to today's data. And Esri included the swipe map feature, which I encourage you all to take a look at, where you can actually pull the map over and view. So I compared the data to mortgage denials. I compared it to zoning patterns, property values, race, poverty, vacant properties, development trends. And at some point I looked at a lot of different metrics. I looked at crime, I looked at public health, but at some point I kind of wanted to define the scope of work as really around housing, but we're looking at including some public health metrics in comparing them with the redlining data. We're looking at comparing violent crime with the redlining data. So a lot of things are coming out of this as a way to sort of move the project forward and take the data forward. If you think about redlining in terms of when it happened in 1938. So in 1917, you had what was called racial zoning. And we're looking at the 100-year anniversary of the abolition of racial zoning. So what racial zoning was the idea that there were black blocks and white blocks in a city, and cities were divided by race. That was overturned in 1917 in a case that came from Louisville called Buchanan versus Warley. There's a symposium at U of L next week, and what that did was really give rise to the notion that city planners and banks had to look at new ways of zoning a city. Real quick, I want to view the story map. So here's the actual story map. And as you can see, I overlaid the old map so that you can actually click on each category and pull up the 1937 assessment. And when I included metrics like poverty, with the swipe feature, you can actually, and it may take a minute to load. So I was really interested in taking the data into neighborhoods. I wasn't really concerned with a statistical analysis because the last thing I ever want to do to a neighborhood is walk into a community meeting with a lot of R values. You're just going to lose everyone, and no one's going to listen to what you say. So I was really interested in what we call in geography autospatial correlation, which basically means things that are close together tend to be more related. So when you use the swipe feature to pull the map across, on the left you have the redlining area, the redlined areas, and on the right you have areas of concentrated poverty. You see that they follow the same lines. And this has been a real powerful tool to take into neighborhoods and to use to teach young people, because the visualizations allow for almost instantaneous correlation. So it's a great way of sort of explaining what happened, or in the context of the context we're working in today. So when we are attending planning meetings or we're talking about public health, this data can really be a powerful tool in shaping the way people think, because it puts everything in a historical context. And what it means is that the problems that you find in West Louisville today were problems that were created by plans and public policy. And the only way to solve those problems is to create a system that starts to dismantle those plans and public policy. So I encourage everyone to take a look at the map. If you go to Google, type in redlining Louisville, you can find it pretty easily. The maps are not really made to be presented, it's really made to be explored individually. So I encourage everyone to take a look at that if you haven't seen it, and thanks for letting me present. Have a good day.
Thank you, Joshua. And now up next we have Vashti Rutledge.
Good morning, everyone. I'm Vashti Rutledge, and I am the Cincinnati Director for the Family Independence Initiative. So before we get started, I want to take us all on a short journey. I want you to think about your family. Who's in your family? You know, who are you taking care of? Who helps take care of you? And how are you able to do that? Work, other financial support, child support, alimony, whatever it is that you have in arm's reach that allows you to take care of your family on a day-to-day basis. And think about in a given year how much money that is. Now let's think about all the things you have to pay for. Rent and mortgage, utilities, child care, transportation costs, food. Maybe you want to get fancy. Maybe you want to do something more than breathe. Maybe you want to go out every once in a while, you know? Maybe you want to go to a restaurant or go to the movies or go to a Bengals game. Maybe not. Think about how much money you have month to month when that's all said and done. Now let's talk about debt, which is everyone's favorite thing, I'm sure. Do you have a mortgage? Do you have a car payment? Are you still paying off student loans? Do you have credit cards? 1, 2, one for every single store that you like to go to? Okay. How much debt do you have? And compare that to how much money you make every year. Now, if you're that one person or two people, I'm thinking there's not that many of you, who pays cash for everything, has no debt, no credit cards. I want to speak for most of us in the room when we say, yay. You're so great. And if you're like most of the rest of us, I want you to think about that number you started out with and how much you owe. And then I'm gonna say, what's wrong with you? Why do you have so much debt? Why didn't you buy a cheaper house? Why didn't you get an older car? Why do your kids have to go to private school? Why can't they go to the neighborhood school? Why don't you make better decisions with your money, with your life? How does that feel? How many of you are like, get off the stage? That's how we approach families that are living in and around poverty. Without knowing your story, without knowing your family, without knowing the goals that you have, I'm standing here judging you and making a decision about the choices you make for your life. Is there anything about that that could possibly be right? And who am I, some stranger, to assume that I know what's best for you and your family? Yet we've built almost an entire sector that says, we know better than you know. FII is hoping that we can shift that narrative. Oopsie. All right, hold on. I'm just gonna keep pushing things. There we go, green button means go. Give me a second. So, how do we know this works? We know that social capital works because people in communities across this country for decades have figured out a way to support each other with each other. So when we look back at our history as a country, there are communities that have been able to support themselves with an infrastructure within their community without reaching out to a sector of people who are telling them that they know better. Some of the examples of that are the Chinatowns that we see dispersed across some of our larger cities, where people are coming here from other countries and figuring out a way to develop a life and a way to take care of their families, oftentimes supporting families back in their country of origin, by navigating through a system and a community that has consolidated its wealth and its knowledge together. We know that for those of you who are familiar with Black Wall Street in Tulsa, Oklahoma, that there was a community of African Americans in this country who had developed a community that was self-sufficient. Banks weren't gonna give you a mortgage, right? There weren't gonna be communities that were gonna open their doors to you. They said, we'll create our own community space. They had banks, they had lawyers, they had doctors. And unfortunately, due to some of the more challenging issues within our country, racism and things like that, that community was burned to the ground. But that ability to build community infrastructure still exists. What we know about families who are living in poverty or close to it, is that they work really hard. There's a narrative that often says something different, but we know the reality is that these families are often working multiple jobs. Many times they're working multiple part-time jobs because they're unable to get a full-time job with benefits that provides them with some of the investment and benefits that many of us in this room have. What typically happens is that these families are able to work themselves out of poverty, but within 5 years, they go right back in. So the reason why the numbers rarely seem to be shifting is because every time somebody climbs their way out, they slide back under. Well, why does that happen? I think here one of those buzzwords, cliff effect, right? What is the cliff effect? It means when something unexpected happens, when your car breaks down, when your child gets incredibly sick and you have to take off work, you don't have the capital to weather that storm. You don't have a full-time job where you can use sick time. So now you're just taking off work. How many days can you take off work and still have a job, right? So something that should have been just an issue becomes a crisis. And that is how oftentimes families find themselves falling back into poverty. What FII does is we acknowledge that this is the reality, and we know that what families are dealing with is that they often have a considerable lack of access to capital, financial capital and social capital in the same ways that we think of it. Oftentimes I say, how many people are you connected to on LinkedIn? When a new job opportunity pops up, how many people might tell you about it? Those are pretty significant pieces of capital that we often take for granted. It's not just who you know, but how do you put those relationships to work? So what we try to do is trust and invest in families, and like I said, and it says on my presentation, and get out of the way. Because we believe that they have the answers for how they can be most successful. So we're not a program, we're an initiative. We don't tell a family how to do it. We try to provide a little bit of support on the outside so that they can do what they're already working at. We use a up-together data system fund that we use to connect with the families. So families that are in FII make a 2-year commitment to us, and we make a 2-year commitment to them. During that time, they work together in a cohort of 6 to 8 that they choose themselves. And that group meets on a monthly basis, talking about the goals that that family has set. What are you doing to work towards your goal? Why didn't you do anything to work towards your goal? What's something that happened this month that was a barrier or a challenge? What's a success that you had? And those conversations allow them to hold each other accountable and provide support for each other. What we provide are some incentive resources. So families who start out with us get some small stipends for us to, one, help them be able to participate. So we give them a small stipend for data. They're able to access our Up Together fund, which is all online, and our data system. They journal with us on a monthly basis. So they're sharing a lot of that demographic information that we were talking about at the beginning. Who's in your home? How much money do you make? Right, the things that they would typically share with all nonprofit organizations if they're asking for assistance. But what we also ask them for is, how are your kids doing in school? What's something that you're working on for yourself? How's your health? What is something you did in your community this month to help out a friend or a neighbor? Those are things that we don't typically capture, and we really try to help families focus on their assets. So it's not what's going wrong, it's what's going right, or what is it that you would like to see happen in the future. We often think about families based off of their deficits. A young mom who comes into an organization might be identified because she's single, because she lives in Section 8 housing, she receives SNAP. But what she thinks about herself is that she's a mother of 3A students, right? That she's participating in a lending circle, and she's an entrepreneur. And what we really want to focus on is the assets within a community and within an individual family. So as you see, families are inputting their data monthly into our data system. When they do that, it's not just for us, it's for them. So the data that they share with us, does it benefit us? Definitely. It's how we're able to talk to our community and say invest in FII so we can invest in families. We can share this is what's happening with families in our region, why this makes sense from a big picture perspective. But the individual family gets their own information back to them. They get their own dashboard that says, this is what my progress has looked like for the last 6 months. Oh, what was that little dip? Maybe it was the holidays, right? Gets us all, right? Oh, this is how I get back on track. So families have the ability to track their own progress and see what's working for them, and maybe even make some decisions about what's not working and how to change that. Our role is really to be there, but not be there, right? So I'm not there to tell a family how to do it. I don't facilitate their meetings. They decide when they're gonna meet, where they're gonna meet, how the meetings are gonna be run. They decide what they would like to do with the resources that we make available to them. What I'm there is to be kind of like a little fly on the wall. Hear their stories, learn from what they're sharing from us, and use that information to gain a better understanding of the families in our community in a way that we typically haven't been able to see them. And most of this data, so let me make a quick disclaimer, I'm gonna step aside. The Cincinnati region, because of Cincinnati, but we're serving Northern Kentucky and taking a regional approach to FII here locally, just started August 14th. So these numbers and this data is from our national information. So now step back on. Okay, it's like this isn't happening here yet, but it will be happening soon. So what we typically see is that families are using their funds for a variety of different things. Financial health, that could be paying down debt. It could be saving for a big purchase. It could be for entrepreneurial activity. We know a lot of families have small micro businesses, things that they are maybe doing on the side that they would like to do full time, but need a little bit of a push, a little bit of an investment to have the funds they need to get that kickstart. So sometimes they're using the funds that they can get for us to do that. Sometimes it's transportation. So far as I've been talking to families across our area, I have not talked to any group of families where at least one person in that room did not say they had a transportation issue. It is really prevalent across this community, and you see here that out of the different things that families are using their funds for, the largest draw is transportation. So we see that with our families across our sites, and that would be Boston, Detroit, New Orleans, the Bay Area in California, and Albuquerque, New Mexico. So a variety of different places across the country where FII is currently operating, and I won't be surprised that the largest draw in the Cincinnati area is also transportation. So what's our investment? So our investment with families is up to $2,400 during the 2 years that a family is engaged with FII. What do families do with that income? Because that's modest, right? When you think about, like, that's not going to lift anybody out of poverty. It's not going to, right, disrupt the entire system with $2,400. But what families are doing with that money is what has the potential to be disruptive. They're growing their income, right, by about $5,800. It's typically about a 23% increase in income. So all of you who thought about how much money you had, right, for per year, now give yourself a little 23% bump. That has the possibility of being really impactful. They're also growing their assets. And so what does that mean? That means oftentimes that something that they owed on, they now own. It means sometimes even that they've increased debt, but it's good debt. So a family who was on the bus now has a car, or many of our families become first-time homeowners. So they may have more debt, but they now have assets in a way that they didn't have before. What we can invest in families, though, is paled by what they invest in each other. Because what families are able to do is in that small cohort, they begin to provide resources and supports for each other that maybe typically wouldn't have happened if they weren't sitting in that space month after month having those conversations. So what we calculate is that the resources that families have exchanged between each other is about $2.7 million. A quick example is at one of the first meetings I had with a group here locally, just so they kind of understood, like, this is the process, we started going around the room and talking about the goals that they were setting. A family shared that they were going through bankruptcy, and one of the biggest issues they were having is that they felt like they were going around in circles chasing papers. Soon as I could, think I'm ready, they're like, you need something else, I gotta go find it. I'm always having to run to Kinko's to make copies, and I just feel like it's just really stressing me out how much time I'm going back and forth around chasing papers and making copies. So then the group goes, I have an extra printer, it's in the box, I don't use it anymore, I can give it to you. Now these people are not best friends, they're connected by like 1 degree of separation. So had they not been in that room together having that conversation, she would not have known that there was someone within her circle that had the answer to her need. Now, and I told them, it's not always gonna be this easy, right? It's not always gonna be that someone's like, oh, I got what you need, but usually someone in your group has an idea, has a personal experience, right? If there's a group of people who wanna buy homes, but there's someone else in that group who just bought a home or is already a homeowner, they can help give the others insights into what that process looks like. If people decide that they wanna work on their credit, which is really popular, or their financial health, they can approach that together. One person may know of a nonprofit in the community who works on that issue, and they can have someone come and speak to their group. And the great thing about it is that they're doing it themselves. I'm not stepping in and saying, you should really call Smart Money because this is what they do. It's like, that is not my space. My space is to be there and be that little quiet little person in the background who can answer questions about FII. Their space is to take the leadership and own their futures. So we use technology pretty heavily. Their journaling is online, the way they access the resources is online, and when they're journaling, they're sharing the specifics of the goals that they've been trying to reach, and we're getting really great details, not only about their goals, but about everyone in the household. How their kids are doing in school, if they lost weight this month, if they set that as a goal, things like that. We have over 40 different data points that they're sharing with us on a monthly basis. So it gives us a really rich picture of each individual family that we're able to then pull out and see a picture of the community in a way that typically you may not have seen some of those incredible assets. So this is a little bit of what a family might see when they pull it up. So they would look and say, okay, here's where my income has been for the last 6 months. Oh, someone got a new job or something like that, right? Our income has rise, and then use that information to say, okay, what does that look like? What does that mean for us? What are we gonna use with those resources? How do they connect with the goals that we've set for our family? So those personalized reports are really important to us for how we do our work, because we feel like if we're gonna ask families to share this really incredible, rich information with us, it better be useful for them. And then secondarily, it helps us talk to our stakeholders and our funders in order to have an investment to give to the families. In addition to the resources that we provide, families also have access to some secondary resources like some lending circles, loans from Kiva, Mission Asset Fund, which is another kind of lending circle opportunity. But I'm out of time. So for any of you who are interested in knowing more about FII, I'll be here during lunch. And want to thank you for the time and opportunity to share a little bit of our work with you.
Thank you so much, Vashti. Knowledge is power, definitely, in empowering our communities with the more data we know. So now we have Michael Topmiller, the Health GIS Research Specialist at Health Landscape.
All right, thank you. So today, I'm going to talk to you about an initiative I'm involved with. It's a Robert Wood Johnson Foundation program called Interdisciplinary Research Leaders. So I'm a researcher, and before I dive into the program, I give a little context for what we're doing in Cincinnati. So most of you should be aware, or are aware, that in Cincinnati last year they passed a school levy that provides near universal funding for preschool in Cincinnati. So as a researcher, we were working on this great opportunity. I thought it was a really good opportunity to look at preschool in Cincinnati. Our focus was early childhood health, so we're going to look at what's going on with preschool and make that a big part of our project. So the first thing that we did is we went out to and figured out where our priority neighborhoods were going to be. Now, I'm not going to go into details. I don't have time to explain why we chose Carthage and Roselawn. But went out, figured out Carthage and Roselawn are neighborhoods. So if you're familiar with Cincinnati, they're in the northern part of the neighborhood. And the bottom right map there is kind of a close-up to the neighborhoods. Basically, they're split in half by I-75. So we went out, we collected a bunch of data on the neighborhood. So we went to the Census Bureau, we went to Health Landscape and the UDS Mapper, 500 cities, all these really great data sources to figure out what's going on in these communities, how does that relate to early childhood health, and how will that help us with our research project. So in a traditional kind of research academic model, this would have been a really key piece and one of the primary pieces in what we're doing. So the secondary data are important. However, we're missing a lot of stuff. So if you've been involved in the research world, a lot of times research happens on communities where the community isn't involved in the research process at all. You may do some interviews, do some surveys, but the community is not involved in the research. They're not setting the priorities. They're not deciding what the key things are about. So the RL program through Robert Wood Johnson Foundation is trying to change that process. So I work with Jamie Lee Morris, who is a community organizer at New Prospect Baptist Church, and Farah Jaquez, who's a professor at University of Cincinnati, who's done a lot of community work in the neighborhoods of Carthage. Jamie Lee Morris is actually a community organizer in New Prospect Baptist Church, which is in Roselawn. So that's why the neighborhoods are our focus areas. So we created an initiative called Communities Acting for Kids Empowerment. So the idea is, even though we have all this data about these communities, we have an understanding of what's going on in terms of the demographics, the poverty, access to preschool, things like that. We don't know anything about what's really happening. So we went out using our context in the neighborhood, working with Jamie Lee at New Prospect, and create a community leadership team to help us figure out what is our research project going to be about. So we worked with some folks at Carthage Christian Church, the YMCA, Sukasa, other folks in the neighborhoods. Here's a few of the members here you see on the screen. So the idea was who in these neighborhoods is doing work, who are the community leaders, who are people that have a lot of knowledge about early childhood health, preschool, that can help us set some priorities for these neighborhoods and figure out what's going on. Here's some more members here, YMCA, Sukasa. And so we had this great opportunity. We brought this leadership team together, and these were our aims. So to create a network of engaged community members, providers, stakeholders ready for action. So the key here is we're not going in saying, we're going to increase access to preschool because that's what's important to your neighborhoods. We don't know that. We think it's important, but we're not sure. So our idea is we're creating a network of people who are ready to act, who care. So no matter what the topic is, we have people that in the community that are wanting to help and make things better. We're also increasing awareness of preschool and preschool options. So even though it's not the primary focus, we understand that's important. So we're bringing knowledge to the community about why it's important. And if you want to get your kids signed up, what are the resources available to get your kid access to some of the resources through Preschool Promise? And the last thing we're doing is developing a multi-level intervention. Basically, that it's going to be decided with the help of the community leadership team and the community. So we're not going in with a project, this is what we're going to do. They're telling us what they want us to do, and we're going to work with them to make sure we have funding to make that happen. So since this is a panel on innovations in community health data, I thought I'd put this up front instead of waiting to the end. So what are the things that we're doing which is different than any other research project I've been involved with as a researcher, is we're working with the community to collect data. So we're not collecting data on the community, we're collecting data with the community. It's also a place-based focus. So a lot of discussion about place-based things going on here. So it'd be really hard to do a research project figuring out, okay, we're going to solve early childhood health in Cincinnati. That's a pretty broad goal, or a larger area. We're focusing on 2 neighborhoods so we can actually figure out what's going on and create specific interventions to help the families in these neighborhoods. The third thing that we're doing is we're asset focused. So while we're discussing things like what are the barriers, what are the needs, there's a big focus on talking about what are the things that are going well in your community and what are the things that maybe are assets in your community that could be enhanced to help meet some of those needs that we talked about before. And the last thing we're doing is looking on multiple levels. So we're doing community forums, which I'll talk about in a few minutes. We're doing interviews with teachers, parents, administrators. And we're also going to be doing household surveys next year to kind of get a perspective on multiple levels on what are the things that are most important to these communities in terms of early childhood health. So we actually started in August with some community input meetings, we called them, group level assessments, where we actually brought in people at New Prospect Baptist Church, San Carlos Church in Carthage, and as well we brought in some preschool providers in Roselawn as well, and had them tell us what are the things that matter in terms of kids' health, what's going on. So basically had them come to a setting smaller than this with a bunch of poster prompts around the room with things like, what are the things in your neighborhood that make kids happy? What are the assets in your neighborhoods? What are the barriers in terms of getting kids to preschool or other things in your neighborhood? And had the participants that were there write down in their words what they thought about each of those prompts. And then we all came together and had them prioritize, okay, what are the things we're finding through all these different prompts? And what are the things that are most important that we want to focus on? And again, we had a very much of an asset focus, trying to figure out, okay, what are the assets that are in your communities that can help us address some of the needs? We haven't done it yet, but we're doing a sketch mapping sessions where we're going to give folks at the Roselawn Community Council, some other neighborhood associations, maps and have them map out, okay, what's going on in your neighborhood? Where are areas of concern related to crime, traffic, safety, things like that? What are the good things in your neighborhoods? An old rec center or something else that might be important. So the idea is if we can combine the things that they're interested in with some place-based things related to what might be helpful in the future, it'll help us plan the interventions and figure out, okay, what can we do specifically to help these neighborhoods? And here's some of the flyers we created for some of these meetings that we had. Now the process, right now we're actually planning out and scheduling our interviews for the next phase. So we're going to be working with some teachers and parents and administrators in a handful of schools in and around the neighborhoods to figure out what's going on. And here we're interested in finding out, okay, what are innovative programs going on in these schools that are helping kids thrive? And also at the teacher or classroom level, what are some strategies that teachers are doing to engage parents to help kids improve their education? And finally, working with parents and figuring out, okay, what are the things that you're doing with your child to help your children thrive? Is it how are you interacting with your teachers? How are you helping them with their homework? What are other strategies that might be helpful to help your kid do well in school? And the idea here is, once we identify all these strategies, we can pull them together and we can help disseminate them more widely to other areas as well. So the last piece that we're planning on doing next year is some household level surveys. So the idea is here, working with our community leadership team to figure out what are the key things that we want to ask in these surveys. Again, as a researcher, I'm having a really hard time with this because I want to know what my outcome is. I want to know how am I going to design the survey. I want to know what I'm going to be looking at. And we're still not there yet, which is really hard for me. But we're getting closer and closer. So the idea is we're going to create this survey with the community leadership team, have the community members that we're meeting through our different events team up with graduate students to go door to door to administer the surveys and figuring out what's going on in these communities, asking questions, okay, you have kids in a household, how are they doing, asking them about their health, about their education, and we're gonna analyze those data and look for outliers. So we're gonna look for spatial outliers, okay, is there portions of a neighborhood where the outcomes maybe aren't as good as they are other places, but we have these two households here, their kids are doing really well. We're gonna go out and find those, go back to those households and interview them and figure out, okay, what are you doing in your households that is the reason that your kids are performing so well? So the idea is kind of combine this quantitative approach with a qualitative approach to figure out what's going on in these households, to identify those household strategies that can help us to improve health. And the next piece is going to be different community and policymaker forums. So we've already begun talking to different, I didn't do anything there. It still works back there. There we go. So we're already working with our community leadership team, with some of the neighborhood councils to figure out what are the major events that you have every year, and how can we make ourselves part of those events to start disseminating some of this information. So one of the other things that's, as a researcher, a lot of times you work with the community or you work on data on a community, and then you leave, and then the community wonders what happened. You know, you got all this data from us, but we don't know what the results were. We don't know how it's going to help us. So the idea is here, we're going to make a strong effort to make sure we're out in the community, working again with our partners, Jamie Lee Morris, the community organizer, helping us organize events, getting people out to say, this is what you told us is what is important, and have them respond to it and basically say, okay, does that sound right? Are there things we're missing? And again, we're planning a whole bunch of these forums in the communities to get that information out so they can get the feedback to help better plan our final intervention. So through the grant, there was a lot of emphasis on myself and FAIR, the researchers, to say, okay, we need to collect this data, we need to get this dissemination plan, and we need to do the intervention within 3 years, a 3-year project. And we got pushback from our community organizer, from our community leadership team saying, that's not possible. There's no way you're gonna be able to get an understanding of what's going on in the communities in that short time period. So the final goal for us is to do all the activities that I mentioned before and then create an intervention plan that can be carried out with the help of us in terms of identifying funding sources, writing grants, but with the network of engaged individuals that we have in the neighborhoods. We're already getting great feedback, people emailing us, calling us, wanting to be more involved with the project. You know, I live in Roselawn, how can I help? So the idea is to work with them, create this intervention, create some kind of intervention plan, but have a sustainable network into the future. So why this matters? Again, to contrast this with the way research is traditionally done, it's community driven. So working with the community to identify those assets and needs on multiple levels. Building the community network I mentioned before is probably the most important piece. How do we get the community engaged? How do we help them build up their network so they're able to carry out not only the project that we're interested in, but a whole other host of things that can help improve their community. And finally, the place-based data. So we're very much an emphasis on the two communities, Carthage and Roselawn, so we can plan something that can have a direct impact on those communities to help them in the near term and also in the long term. And I think just my acknowledgements here. So I got to acknowledge the community leadership team, which you saw before, my IRL partners, Jamie Lee Morris and Farah Jaquez, the Robert Wood Johnson Foundation, and all of our other community partners that we're building every day. So thank you.
I think we have about 10 minutes for questions. until 11 o'clock. And so really great projects using qualitative and quantitative analysis and interdisciplinary ways of solving complex problems in the community. So yes, question for who? Michael, go ahead.
That's a very interesting thing, and I wanted to just see if there was more information about how you're going to do the door-to-door, and also more information about whether if somebody could present to your group of stakeholders for 1 or 2 additional questions to be added to that survey.
The second part I'll talk to you about afterwards. The first question is something we're actually struggling with the leadership team. So when we first brought the idea of door-to-door surveys in the neighborhoods, they said, no way, this will never happen. It's just not going to work for a variety of reasons. So we've been talking with them about how we're going to do it and why it's important. So there's been a few things that have come out. Actually, I've been doing some research on other folks that have done door-to-door surveys in neighborhoods, different kinds of neighborhoods. And so the idea is we're actually going to be doing a lot of outreach way before we do the survey. So we're going to have community members with graduate students along with us walking out, talking to people, leaving door knockers in the areas we're going to survey and saying, this is our project, this is what's going on, give them some more information. Then we're gonna go back again and basically knock on doors and talk to them and say, we're gonna be coming back in a few weeks to ask you questions. This is the purpose of the project. If you have any questions with us, here's our contact information. And then we're gonna go back a third time and start the survey. So it's gonna be a real slow process. We're working with our community events. We're getting a lot of feedback from residents. So we're actually working with the Roselawn Community Council. They're planning a big meeting in a couple of weeks. We're trying to bring in, we're actually going door to door to try to get people to come to that meeting. And we're gonna basically use that as a platform to start basically getting people interested in this idea. And again, if our leadership team says we cannot do the interviews, we will not be doing the interviews. But I think that we will be doing that, or hopefully, as we kind of convince them through this process about why it's important. So.
Anybody else? Yeah, you go. That's you. Yeah.
My question is for Vashti. So I'm a prevention specialist. I work on substance use prevention in the northern 8 counties in Kentucky. So I spend all my days talking about needle exchange or, the substance abuse issue and why it's not just personal choice. And then I go home and I have my individual conversations with family or friends who still have their lines about, well, that person did this one time, so it's just on them. Do you have a good response to that kind of statement when you're trying to engage people, not necessarily in a professional level, but just the communities that we live in when we go home at night? I loved the little strengths versus weaknesses thing you put up. I didn't know if you had another one-liner to just kind of shut it down.
I don't have a one-liner, but it's definitely something in this conversation that happens on a fairly regular basis, right? That someone I had someone ask, are you working with them on their deficits so that they don't get in this situation again? And my internal clock was like, take it, Jesus, because I was like, oh goodness. And so sometimes the best way to answer a question is by not answering the question. And what I did is really shifted that conversation to talk about what people are really like, right? And so I think for you, right, when you're seeing people in fairly challenging situations, but that if you develop relationships with some of them, you become aware of who that person is above and beyond addiction, right? Addiction is a part of who they are, but it's not who they are. And so I think that's what I try to do when I talk about the family. So I don't say poor families anymore. I say the families who are living in or near poverty, because what we have as a community is a lack of livable wage employment. And so there are a lot of families in our communities who may be right above the poverty level. And when you ask people, are you poor? Most people say no, right? But when we look at the data, it tells us a very different story. So it's really, for me, always trying to shift the conversation into what people are really like, right? If they're a mother, if they're a business owner, if they are a student, and saying, this is who this person is, and the thing that they're struggling with comes after the fact. And I don't know if that'll be helpful at all. I wish I had a one-liner. I know. I mean, definitely. It's one of those things where sometimes it's like, would that even click with them, though? Sometimes the one-liner doesn't click, and it takes someone like you who's invested in having that conversation to sometimes repeat yourselves a couple times before they get it.
I've got two questions. One's for you. And is there ever any interruption in the digital availability that people have from participating in your project? Because people consistently may not have that access. And since I got the mic, let me ask him a question too, if you don't mind. How have you been able to correlate the relationships, if you will, between housing and access to housing and the health-related issues? Or is that something you're doing, because the whole redlining piece is carried over to the housing crisis in 2006 and 7?
Yeah, I'll go. So I'll repeat the question, I'll paraphrase. So her question was around access to the technology. So it is definitely true, right? A lot of families don't have Wi-Fi in home. There is a digital divide that still exists in our area, and how do we kind of deal with that? So one of the things that is a part of our model is kind of pushing families to figure things out. So if at the first meeting a family says, I don't have Wi-Fi, I'm like, oh no, what are you gonna do, right? And I say it out loud because someone in the group is like, you can go to the library. I mean, it happens all the time. So part of our model is that we give families a technology stipend. So right when they enroll, they get $300 from us that they can use to get a smartphone, a tablet, a less expensive laptop so that they can access our online platform. A family that already has a smartphone that they can use to do that can use that money to pay for, right, Wi-Fi, or they can just use the money however they see fit for their family. So that's one way that we try to help with the technology piece. But definitely before enrollment, they have to figure out how to go online and do, because part of the enrollment process is them filling out kind of like their online profile. They have to figure out how to do that before they get their technology stipend. And I think that really helps us see the families that have the initiative that are going to stay and go through the process for the 2-year period. Right now, our retention rate is 95% at 2 years. And I think that's because the families that do this opt in and really want to be a part of it.
Yeah, so about the public health data, redlining didn't happen in a vacuum. There was a lot of planning going on around that time, and what redlining did was really determine how capital flowed in and out of space, but city planners were shaping that space. So one of the things I've looked at is really the history of city planning, and there was a gentleman named Harlan Bartholomew who really had a lot to do with shaping a lot of cities. Bartholomew was in charge of the placement of interstate highways in cities. And one of the things he did as a planner, he tried to predict where black people would move to in cities and zone those areas industrial. And that's why we have one of the reasons we have such poor health outcomes, but we have to remember that was planned and that was very purposeful. So in Louisville, we looked at, there's an area called Rubbertown, and it's adjacent to, like a lot of cities, adjacent to a black community. So when we map, I've been involved in mapping asthma rates, for instance. When we map asthma rates, we find that they're clustered in those areas. So that's one of the ways that the historical work that I've done. I've been working with a lot of people in public health data really on the sort of the next project out of this, and looking at how those historical plans and policies shape public health. So.
Looks like we're bringing the mic to somebody else.
This is another question about planning. What do you see in the future as cities are starting to grapple with the whole climate change issue, and how that's going to be affecting, cities and neighborhoods and cities?
Oh, wow. I'm sorry. Would you mind asking that again? Or just asking how do I see climate change affecting?
And how cities are sort of grappling with what changes. I can tell you that in Cincinnati, they're predicting more severe precipitation events and more severe heat events, like 20 or 30% more in the next 5 years.
That's a really difficult question. I I mean, when you think about city planning, you know, after World War II, most plans were made for a certain demographic. They were made for white suburbanites, you know, the plans were designed to facilitate this move for this demographic to move to the suburbs. So we were talking about most of the city planning we're seeing, most of the efforts of city planning right now are really designed for millennials to move back to the city. So you see it in Cincinnati with Over the Rhine. And you see it, it's not happening as much in Louisville, but Louisville's starting to catch up. So every city plan that you see, you know, anyone could be a city planner. You just study graphic design and take a city street and put some people with, you know, bicycles and walking dogs and coffee on it, and you've got a great plan. And, you know, I've got a slide where I go through different cities, and every city has this rendering. As if that's all we have to do is create places that white millennials like to go to, and we've done our job. We're really not looking at climate change on the deeper level, I don't think, within the profession of city planning. I think the profession needs to really take a look at itself. I can be real critical of city planning.